Hi everyone. Welcome back to BinaMedicineRx. Today, we're talking about a common medication, paracetamol, also known as acetaminophen, and how to use it safely for children. Let's dive in. Paracetamol is widely used to relieve fever and pain in children. It's available over the counter in various forms, including liquids, tablets, and suppositories. First, let's talk about dosage. Always follow the dosage instructions on the package or from your doctor. Dosage is usually based on the child's weight, not age. For children, the typical dose is about 15 milligrams per kilogram of body weight, given every 4 to 6 hours as needed, but not exceeding 5 doses in 24 hours. Always use the dosing tool provided with the medicine for accuracy. Safety is key. Never give adult paracetamol to children, and avoid using multiple products containing paracetamol at the same time, as this can lead to accidental overdose. Watch out for signs of overdose, such as nausea, vomiting, loss of appetite, or confusion. If you suspect an overdose, seek medical help immediately. And remember, always consult your child's healthcare provider if you're unsure about the dosage or if your child has any underlying health conditions. Comment below the weight of your child, and I will tell you the correct dose of paracetamol to be given to your child. That's all for today. If you found this video helpful, don't forget to like and subscribe for more tips from BinaMedicineRx. Stay safe and take care.